I'm going to show you how to change the treatment a patient has booked in for because it might not be suitable for them. So here we have Andres. He has booked in for tear trough filler. Now, during your consultation, you may determine that a patient is absolutely not suitable for the treatment that they've booked in for, but they may be suitable for an alternative treatment. And in this case, you need to focus on this section here, which is recommended treatments. Now, the treatments that you place in this section here determine the form that your patients need to sign in terms of consent. So by updating the treatments that you put here, the forms that they need to sign are automatically updated. So what I'm going to do here is I'm going to take out the treatment that the patient initially booked, tear trough filler, because they're not a good candidate, and they may well be a good candidate for a different type of treatment. So I'm going to pop them in for some polynucleotide treatment. Of course, you would want to document that this change has occurred. So they are unsuitable for tear trough, spelling, for the following reasons, X, Y, and Z. Advised that polynucleotides are a better option. Now, you may also want to reiterate that advice in the email summary that you send to your patients. So you may want to just reinforce that there. And you're then going to proceed with the treatment. Now, of course, before you're able to get to that treatment record, you'll see we put a block on this because the consent form isn't signed. You need to hand your device over to the patient by locking it first. This restricts them from accessing anybody else's medical or sensitive data. They can only access their own. They simply need to sign that consent form and then hand the device back to you. You enter the same PIN to unlock, and as you do that, it saves all of those forms against that treatment record, and then they all are encrypted and anonymized and housed really securely. We're then able to proceed to the treatment record where you can carry out the treatment, document it as you usually would, and then take payment. So the key thing here is to ensure that the recommended treatments that are in this recommended treatment section reflect the treatment that you would like to carry out on your patient, or if you're doing a consultation only, the treatments you would like them to consider.